Good evening. Thank you for joining us for our pharmacy question and answer panel discussion this evening. This is Sarah Lawrence, Director of Partnerships for the Student Doctor Network, and it is my pleasure to welcome you to our presentation tonight. Most of you are probably familiar with SDN, and so you already know that we are the largest pre-health and health professional website in the world, with over 450,000 members spanning a variety of doctoral healthcare professions from medicine to dentistry, pharmacy, to optometry and beyond. Tonight's discussion is our first webinar that will focus specifically on the profession of pharmacy. We've assembled a great panel tonight to spend some time with you for the next hour, and I'm particularly excited to participate. So I'll go ahead and begin introducing our panel now. Our first panelist, waiting for the slides to pop up. First panelist is me. Again, my name is Sarah Lawrence, and I graduated from pharmacy school in 2011, and after that I completed a one-year residency in community pharmacy and ambulatory care. I currently practice in the area of formulary management, and I also teach pharmacology and therapeutics to nurse practitioner students. I've been an administrator of SDN since 2006, and I'm currently serving as the Director of Partnerships for the site. Our next panelist is also one of our Student Doctor Network administrators, Chevis Owl. Chevis is a 2013 graduate of the University of Florida College of Pharmacy and is currently pharmacy manager with CVS. He served both as a forums administrator and as volunteer coordinator for SDN. Our next panelist, Ron Kashi, is a 2011 graduate of St. John's University in Jamaica, New York. Ron is an independent community pharmacist who has a passion for serving and improving the community. His pharmacy-related interests include the delivery of immunization services, MTM, reducing hospital readmissions, and pharmacy services in the area of HIV, Hep C, and oncology. Our next panelist is Jackie Ferenzi. He has experience both as a pharmacist in chain retail and in hospital pharmacy. Currently, Jackie works for Morris Hospital as a clinical staff pharmacist and clinical informatics specialist. She has experience with Meditech and with Alaris pumps, and in her current position, she created an employee pharmacy within the hospital that fills maintenance meds and 3-month supplies. Our next panelist is Renee Jarnigan. Renee graduated from the Medical University of South Carolina College of Pharmacy and has been practicing in long-term care as a consultant pharmacist since 1994. Her current position is with the second largest long-term care pharmacy provider in the U.S., where she serves as Director of Clinical Operations with responsibility for 200 consultant pharmacists over 31 states. And our final panelist is Will Clark. Will is a third-year pharmacy student at Sullivan University in Louisville, Kentucky. He completed his undergraduate study at the University of Louisville. His parents are both in the pharmaceutical industry, and Will credits that early exposure with shaping his decision to pursue a dual PharmD MBA and a career in the pharmaceutical industry. With that, I will turn it over to our marketing coordinator, Christy Crisologo, who will moderate our discussion this evening.
Thanks, Sarah. Thanks to all of our panelists for taking some time out of your evening to share with us, and thanks to all of you guys who are joining us this evening. If you have questions for our panelists, then I encourage you to ask as many questions and whatever you would like. You can type those into the questions panel on the right side of your screen there, and those will come to us, and we'll get to as many as we can. Our first question to our panelists is, will I be able to find a job?
I'll go ahead and take that one. So I think it depends a lot on what you're looking for in a job. if you browse the SDN forums, it's probably not much of a surprise to learn that pharmacy, if it's not already saturated, is getting more and more saturated. So something I heard a while back was something to the effect that you can get a job where you want, or you can get the kind of job that you want, but you may not be able to get the job you want where you want, which I think is a pretty fair statement. You may not be able to immediately upon graduating get your dream job in the location that you want, but there are definitely still pharmacy jobs available. Certainly, big cities are more saturated than places that are not quite so populated. And there's all kinds of things you can do to make yourself more competitive in the pharmacy market, right? If a job that you want is highly clinical in nature, you might do a residency. If you're looking to go straight into retail, you should definitely spend your time in pharmacy school getting an internship with a retail pharmacy, et cetera, et cetera. So personally, I have not found the pharmacy market to be as tight as some pharmacists portray it to be, but it's certainly getting more and more saturated with pharmacy schools opening, et cetera.
Anybody else want to jump in and comment there before we move to the next question? All right, we'll go to question number 2. Question number 2 asks, should I do a residency and will I be able to get one? Maybe also any advice on finding and working towards a residency?
I'll go ahead and take the residency question. I think the answer is to both parts of the question is maybe. Whether you should do a residency really depends on what your goals are for your long-term goals in the pharmacy profession. Most residencies are not particularly useful or necessary for retail pharmacy practice. Not to say that won't change moving forward, but at this time, I think most pharmacists who intend to end up at CVS or Walgreens would not necessarily want to or need to complete a residency. There are some specialty residencies in community pharmacy practice, like the one that I did, and I actually chose that because I was interested in academics, and I knew that residency is virtually required for academic positions looking down the road. For hospital practice, my impression from reading the SDN forums is that hiring in hospitals is becoming more and more competitive, particularly in desirable metropolitan areas. And so a residency, a hospital-focused residency, would be an asset if that's the type of practice that you're seeking. Finding a residency has become more and more competitive. I don't have recent match statistics, but I believe that fewer than half of the students who wanted residencies matched to one initially last year, and they had to enter a process after the fact to try to find an open position. It's becoming more and more competitive. One thing that I think bears discussing here is the ASHP mid-year, and so I'm hoping that will jump in and explain what that is and the role that has in residency and in fellowship applications. So Will, do you think you can take that?
Sure. I actually just got back from mid-year a couple days ago, and that is where all students who are seeking a fellowship position or residency position absolutely must go. This past year it was in LA. Next year it's the 50th ASHP mid-year, and it will be in New Orleans. And there's two different aspects to it. If you're seeking a fellowship like I was, you go out there for what is known as PPS, and it's a personal placement services. And it's a different registration, so be sure to register for that on top of the mid-year registration. So you go out there and you pre-schedule all the interviews for all the different companies that you are interested in completing a 1 to 2 year fellowship after graduation. And now, as far as residencies go, I actually did attend the residency showcase, so I got a little taste of what it was. While that wasn't my main goal in attending the show, I can speak to it a little bit. I believe it was Monday and Tuesday of the entire week, and it's split into morning and evening showcases. So from 9 to noon is the morning showcase, and from 1 to 4 is the evening showcase. So what you do is you go there, and all of the different residency programs are set up. They have different booths. You go there and speak to the residency directors, make your face known, give them your CV, business card, something to make a statement and make your face stick with them in a good way. And then after the fact is when things really start to heat up between now and January 1st, because most programs have a deadline of January 1st in order to get your application in. So you come back, get all your letters of recommendations together, which you need about 3 for every program that you want to apply to. Get those together, sent off along with your application, transcripts, letters of intent, and then you'll hear back. I believe matches in March. So between January and March is when hopefully you get on-site interviews for these different locations. And March is when you actually hear back and see if you actually landed a residency position.
Great, thanks. Our next question here asks, with so many pharmacy schools opening up recently, how do I find a quality program?
I'll take that.
If it's the University of Florida, it's probably.
Did we lose Chevis? Well, I think
Don't worry about me.
The easiest and most obvious answer to that is you come to the SDN forums and you register for your free forums account, and you check out what people are talking about on the forums about the programs that you're interested in. Beyond that, you should consider a number of things: cost, length of curriculum, the location of the programs that you're interested in, and anything else that's specific. Anything else that you're specifically interested in. If you're interested in industry, for example, you might want to look for a school that has strong connections to the pharmaceutical industry. When you get to the school in the on-site interview, I think there are some important questions to ask. Can everybody check their mute button? Thank you. Important questions to ask about the curriculum, class size, rotation sites, both variety and diversity of rotation experiences that will be available to you, and just check your fit with the people that you meet on site for your interview, with the faculty, with other students. Finding the right school is very individual, and I guess one benefit of the proliferation of pharmacy schools recently is that you have a lot of choices.
Thanks, Sarah.
You can also make sure, I'm sorry, this is Renee.
Nope, go for it.
That the accreditation of the school too, checking that out to make sure, you know, the program that you're going through is accredited. And there are various websites to show that. The boards of pharmacy help with that, and the AACP and SDN may have that as well.
Very good. Thanks, Renee. Our next question asks, does your undergraduate university affect your admission chances for pharmacy school?
That question is probably pretty specific to what school you're looking at attending. I can say in my case for the University of Florida, I did go to my local community college for my undergraduate studies, and I would say, this is a rough estimate, I don't mean that I did a scientific survey, but I would say probably between a quarter to a third of my class had done community college versus a traditional undergrad. But I think that would be something that's so specific to each school that I don't know if you could make a general rule that could be applied to all colleges of pharmacy.
So it sounds like check with the school that you're interested in, maybe. Our next question, we've got some that may go to some of our other panelists here. I'd like to go into the clinical route of pharmacy, but I'm not sure what specialty I should pick. How should I find this out?
This is Renee. I'll kind of chime in just from the long-term care side. I always enjoyed working and helping people that were older. They always seemed, it takes a lot of time and patience to work with those folks. And I had the opportunity as a young person in high school to work in my hometown pharmacy, and always gravitated toward helping the elderly. And we did some work with long-term care. So I had experience and just kind of seemed comfortable there. So I would suggest finding your comfort zone. Don't be afraid to go outside of it and try something new, but I would highly recommend going to work, even without a degree in the practice setting that you think you're interested in, because you may find out that that's not really where you're comfortable at all, and you might end up pursuing something else along the way as you're in school.
I can add to the question about not necessarily knowing which specialty you're totally interested in. I kind of find this out during my last year while I'm on my API rotations. And if you want to go the clinical route, I highly recommend doing specialties in the acute care setting. For me, I'm interested in oncology, and I chose an acute care setting in oncology. I would definitely recommend doing that. There's transplant rotations available. There's ambulatory care acute settings available if you want to work in an HIV clinic or a diabetes clinic. There are many rotations that you can choose, and definitely get a great idea of what you're interested in as far as a specialty after you graduate and something to pursue career-wise.
Thanks, guys. Our next question. This person says, I currently work at CVS and I am in P1 year, yet I hate working at CVS and I'm trying to look for other companies. I know retail is retail, but do you think those big box chains will ever have a better working environment?
So I used to work for CVS Pharmacy, and I would work for retail for almost 7 years. Personally, I don't want to be a doom and gloom kind of person, but no, I don't think that the work environment will be getting any better. The responsibilities of the pharmacists keep growing day after day. Immunization has made our job a lot harder at big box, giving everything from influenza to pneumonia to Zostavax, the constant amount of paperwork day after day, and the decreasing reimbursement. So these companies try to save as much money as possible, and doing that, they cut down technician help, they cut down pharmacist help. So big box chains, the work environment is hectic. I believe it'll continue to be like that or grow even worse. Just because retail is retail doesn't mean that you won't find a place that is actually wonderful. There's a lot of CVS's out there. If the manager runs the place right, you'll find a great working environment. Same with Walgreens. If the manager is running the place right, you'll find a great working environment. And retail is not only about CVS, Walgreens, or Rite Aid. There's a lot of independent community pharmacies out there that are still starting, people that are creating their business now in 2014, and they're surviving out there. So you can still work in retail and enjoy your working environment.
Thanks, Ron. Our next question, which a couple of you can answer if you want, because it would be good to hear different experiences, asks, are you satisfied with being a pharmacist? Would you still recommend being a pharmacist? And if you had to do it again, would you still be a pharmacist to go the same route?
I can start off. Right now, I am very satisfied with the job that I'm doing. A few years ago, that was not the case. I started out working retail, and very quickly I realized that it was not the type of pharmacy that they show you in pharmacy school. It's not all, rainbows, and you don't get to counsel patients, and it's mostly running around, going to the drive-thru, fixing insurance issues. So I worked retail for quite a long time, and coincidentally received a call from a hospital recruiter, and I started working for Morris Hospital. We were a 89-bed hospital in a rural area, and I love my job right now. It allows me to use all of my clinical knowledge that I learned in school but had forgotten during working retail. We now are starting a program where we're interviewing patients upon admission, so I do get to see patients again. I get to talk to them when they come. I get to talk to them when they leave, and everything in between. I get to go over their profiles, talk to their nurses and doctors, recommend therapies, tailor their antibiotics to their cultures, renally dose medications. It's all very, very rewarding. And I do the clinical informatics part of my job lets me kind of get behind the scenes, and I can make changes, make people's jobs better and easier through the use of the computer and computer systems, so that is also very rewarding. So I would say don't just think that retail is the only thing that's out there for you. You can be happy in pharmacy. If you're not happy where you are, then try looking somewhere else.
Thanks, Jackie. Anybody else want to jump in with your experience? Would you do it again?
This is Renee. I think I'm just going from the bios. I think I'm probably one of the senior members of the panel. So I would like to offer assurance. I'm very glad I decided to be a pharmacist. I find it very rewarding and secure financially too. We do have to obviously, pay attention to that as well. But in terms of being in the profession, I think there's a lot of opportunity for us, even more so today as clinicians, to be recognized for the service aspect of what we do. Finally, there are so many things going on now with MTM, for example. The immunization piece, although I know that's a challenge in retail, interrupting the day and creating more paperwork, but we're starting to shift into more of a service expected role as opposed to a product pushing role. Even in the sense where we are dispensing, there's still aspects of being involved in the process from the clinical side. In long-term care area where I work, there's more emphasis than ever to reduce hospital readmissions. And I know there's a lot of conversation about that in all aspects of pharmacy and in healthcare in general. So that creates a huge opportunity for pharmacists. And if you are clinically driven or driven to go do something that's rewarding and feel like you have an impact, pharmacy is definitely an area for that.
Great, thanks guys. Our next question asks, how do I get to pick the most beneficial hospital rotation sites when it's time for rotation?
I can give some information on that. So when it comes time to picking rotation sites, it's very important to check with your the person responsible for setting up the rotations. Depending on the school, they may have agreements already with certain hospitals. At St. John's University, I was very fortunate that we had a 6-month or 7th-month program with New York Presbyterian Hospitals, one of the top hospitals in the entire country. And it was kind of like a mini residency for us that spanned it over 6 to 7 months. So if you check with your school, usually like in the office of the dean or something like that, whoever's responsible for setting up the rotations, ask them, hey, which major hospitals do we work with, or which hospitals do we work with that offer this kind of experience or work in this field, and the school should be able to provide that information. Also, networking is very important. If you check with kids that were a year ahead of you, you can always ask them their opinion as well. Hey, what sites were really good? What sites were the preceptors teaching you very well, or where did you get this opportunity? So also networking with kids older than you, they can let you know which hospital sites are very good. That's all I have to say for that.
Sorry, it looked like maybe somebody else was going to jump in. Shivas, did you have?
Yeah, sure. So I'll just piggyback on what Ron had to say. It's another thing where students should keep in mind that the rotation process varies dramatically from school to school. At UF, we had a department that handled coordinating rotations, and students had a really pretty high amount of input into the rotation selection process. So I think if you are lucky enough to go to a school where you have a really high degree of input into what you pick, you should model your rotations around what you're planning to do after you graduate. All schools are going to have certain rotation types that are mandatory. I believe that's an accreditation thing. And then I believe all schools also have elective rotations. So try to think about what kind of experiences you want to get before graduation, because it's really probably your last time to sample a bunch of different types of practice sites before, committing to actually working at one. So, my advice would be to just ask upperclassmen, and, like Ron said, if you can visit the office and speak to someone who's actually in charge of rotations, that would be another great resource. And just think about the type of rotations you want to do, and then see if they're available.
Thanks. Our next question, which again,
And that's
what's that? Okay, well, here's another one that a couple of you guys can answer, since you've taken different routes in pharmacy. But what are some examples of different routes you can go with a pharmacy career?
Well, I can speak a little bit about the clinical informatics. This is more of I think it's a newer kind of route in pharmacy. It's definitely not something that I had heard of until I started working in a hospital. When you work retail, all of the formulary management is done behind the scenes by the the head office. They take care of all that. When you work in a hospital, either the IT department or an IT pharmacist is responsible for maintaining the background stuff, all the drug dictionaries, order sets and order strings, supporting dictionaries, directions, routes of administration. Basically, we have to maintain everything that comprises your orders, everything that you could use, and that goes along with for the pharmacy modules. It's called POM. It's the physician order entry. The nursing, the admission meds, which is this in our hospital we call that RXM. So I actually was the one that was responsible for building the RXM order strings, so I had to maintain that, which is several thousand meds. It's very time consuming. So if you like computers and you like pharmacy, that is one route to go. I have been doing several like seminars. I recently went to Boston to the Meditech facility, and we learned a lot there. I've been to several seminars for the Alaris pumps. That's from CareFusion, and that's the pumps that run the IVs. So it does involve some travel, and it's a very interesting way to go.
There are a lot of opportunities in pharmacy. Even when you look at retail pharmacy, the opportunities are tremendous. There's a big box chain pharmacies like the CVS, Walgreens, Rite Aids. There's grocery store pharmacies like the A&Ps, Pathmarks, ShopRites. You have pharmacies in Costco and BJ's and Kmart. You have independent community pharmacies on the corner of every street in the Bronx and in every block on Manhattan. So just in the retail pharmacy world, you have so many different options. And there's more options in hospital. You can be rounding on a team in the hospital. You can be working in the hospital. Even doing CE credits, you meet pharmacists that are working in generic drug manufacturers, or pharmacists that are running a clinical trial or responsible for the safety and data of drugs in a company. So there's a lot of opportunities out there. There's so many different paths you can go. And just being a pharmacist doesn't mean you have to dispense medications. it's more like a stepping stone with that degree to other positions. And there's a lot out there, and especially with the new possibility of having provider status and the more things that we're pushing for, pharmacists can do a lot more things that we even don't realize now. So who knows? There's a lot of opportunities out there.
I would like to add, this is Sarah, that I found a position part-time in academics purely by accident. During residency, I was in a diabetes clinic where I did part of my training and met the chair of Master's of Science in Nursing program, who learned that I had an interest in teaching and invited me to come and teach a class as an audition. They were looking for a new coordinator for their pharmacology program, and I did that and then was offered the job as course coordinator for their pharmacology and therapeutics course series. And so that's another path that's out there in pharmacy that not everyone considers, and that's teaching, not just in colleges of pharmacy, but also in colleges of nursing. I know someone who teaches respiratory therapists. I'm certain that there are more opportunities out there that I'm not even aware of, and that's something that's been very personally rewarding to me. So that's another thing that you can consider.
Great, thanks guys. Our next question says, I've been trying to look for a hospital intern position, but so far it seems hard to get these positions. I'd like to get more experienced with medication dosings as well as the clinical aspects of pharmacy. How should I go about this? I've been asking the therapeutic professors and other faculty, but no luck. Anybody?
I guess I can take that. One thing that people sometimes don't think about is upperclassmen. Remember that you always have students who are either about to start rotations or about to graduate and become pharmacists. And if they currently have an intern position at a hospital, that may indicate that there's going to be an opening shortly. The other thing to keep in mind is to just be patient and keep reapplying. It's really, the job market is very cyclical, and it's just sometimes a matter of luck, applying at the right place at the right time when there's an opening. But I mean, really, I think as long as you can develop some contacts with some upperclassmen, find out who's moving on from positions, you can, position yourself well to scoop up a spot when it becomes available.
Thanks, Shivis. Our next question asks, what are some of the things you can do to make up for a low GPA in order to be admitted into a pharmacy program?
I can try to address that, although it has been a couple of years since I was going through the process. Grades are important if you're looking at schools that take the PCAT. A good PCAT score will make up for a certain amount of low GPA. Activities are also a part of the equation, of the things that you're involved in as an undergraduate, and things that you're truly involved in, that you've spent time on, that you're showing a real commitment. Extra points, I think, if those types of activities are pharmacy related, pre-pharmacy club, shadowing, things that show your commitment to the profession, I believe, would help make up for some deficits on the GPA. I know a pharmacy student who spent many years working as a technician, trying to get his GPA up over that time by retaking classes, being involved in activities, and he was admitted last year to his program of choice. So I believe that there are things that you can do, but I don't want to minimize the importance of good grades, because grades are what show admissions committees how you might perform in pharmacy school. Remember, they want to admit students who can successfully complete the program, and grades are a good indication of that.
Thanks, Sarah. Our next question asks, how do you see the field of pharmacy for future students 10 years from now?
Well, I'd just like to say, hopefully, 10 years from now, we're not trying to fill our prescriptions in 15 minutes or less and dispense fries with that. I hope it keeps getting more clinical, and I'm still waiting for pharmacists to get more of a provider status. I know we are working towards that. So my advice would be don't just count pills now. Work on your clinical skills. Get a specialty. I know the MTM is getting big. Hopefully we'll be getting reimbursed for that soon, maybe. And like with my behind the scenes stuff, the clinical informatics, I know that's still got a big future. That's always changing. We always need somebody there. Anyone else?
I think you nailed it, Jackie. In my opinion, 10 years is a really hard time to make any accurate predictions about the future. But I really feel like Jackie nailed it with talking about going more from dispensing a product to dispensing a service. If we want to stay relevant to the future, we have to get away from the mindset of how quickly can we fill prescriptions or how many prescriptions can we fill to how can we improve overall health outcomes. I don't think it's any secret that our healthcare system is moving more and more towards an outcome-based system, and I think pharmacists are in a really good position to influence that. It's just really hard because historically we have a mindset of filling prescriptions, and that's what the vast majority of us know and understand. But moving forward, we definitely need to look at services, MTM, things like that to really move the profession forward.
This is Renee. If you can hear me, I would just say also that definitely we thought 10 plus years ago there wouldn't be any independent pharmacies out there. And I don't know if any of you all remember that everybody was afraid that the independents couldn't compete with the big box stores and on price and couldn't get product dispensed as quickly and so forth. And then mail order entered the picture as well. But what most of the successful independent pharmacists have done is just that. They've started focusing on services and the clinical aspects of what they do every day, and that, they have evolved. And I think as a profession, that's what we have to do. In 10 years from now, I think it will be much more of a clinical picture as to how we are impacting the health outcomes of the patients that need our help with medication management.
Great, thanks. Our next question asks, how can I network with other current and future pharmacists? Are there professional organizations I should join? Or other opportunities that you all may be aware of for networking?
I can start with that one. No, go ahead. Let Ron take it.
Well, just one. This is Ron. Just one way that you can network with other pharmacists is, well, a couple weeks ago, my owner, he went to a CE session and he took the other pharmacists with him, and I was the one staying back working the bench while they went. They had a wonderful time. The next morning, he gave me a call and he said, Ron, the next time that I have to go to one of these, you have to come with us. Not just because it's a CE and you can learn, but the networking opportunity is unbelievable. Over there, he met somebody that's the head of a company that makes generic medications. That guy was a pharmacist, and he was attending that. That same CE, there was the director of pharmacy from St. Joseph's Hospital, right across the street from us, over there. And he told me, Ron, if you're trying to get your foot in the door certain places, like these are the types of events that you have to go to, like CE dinners or like because it's a great place to meet other people. Even though I work in an independent pharmacy, I do want to enter the hospital world, and I keep telling him, hey, help me get a job in a hospital, and he keeps saying, you know what, you have to meet the right people. And by attending a dinner like this where he knows the director is going to be there, it's a great experience to network with people. Even if I don't get a job in a hospital, you may meet somebody else and you exchange business cards and one name goes to another name, and before you know it, you're getting a call from somebody. So like CEs is a great place to meet people. I know you can join other organizations, but I have never done that. Maybe somebody who is part of an organization would have a better idea about that.
And I know a couple other people.
So I can add something to this as well. I mean, I agree with what Ron said. CEs are a really smart way to meet other, to meet pharmacists. I mean, I think that's a great idea, very out of the box thinking. Like Ron, I did not find much use for organizations in pharmacy school. If we have a panelist who did, I think it would be great for them to share their experience. Personally, I found it to be, to me, it didn't offer very much utility, like to pay money to be part of a group that didn't, to me, offer a great benefit that I could identify. But to answer the question about ways to network, I think just the strongest thing you can do to secure yourself a position after graduation is to be an intern. You're going to meet pharmacists at your work site. You're going to have, you're going to be working for pharmacists, supervisors, the people who hire pharmacists. So I know we've had some questions earlier about how to get internships, but in terms of networking, I would say being an intern and rotations are your two strongest networking options, or at least that was my experience.
And just to add what Shiv just said, what I wanted to add is rotations is key for networking. Honestly, you can be one of these kids in pharmacy school that never took an internship or never had a job before, but when it comes time to rotations, it's very important to meet your preceptors, be very cool with your preceptors, and network yourself as much as possible, because those 6 or 9 rotations that you do in that year can be the stepping stone for 6 possible jobs in the future. And actually, I keep a card of all my preceptors and I keep all their cell phone numbers with me just as a backup, because I know if I ever lose a job, or if I plan to change a job, or if I want to set my foot in a direction that I haven't set it before, I have these people that know me very well, would vouch for me and trust me, and gladly told me that, hey, when you're looking for a job, come back to us or call me if you ever need help. So rotations is definitely a place where you network with a lot of pharmacists, and especially the preceptors. Many times you're under the director of pharmacy or the head of hiring or somebody there. So rotations is key to networking as well.
I would just like to add, kind of playing off of what Ron just said, that my local pharmacy association and my state pharmacy association have been infinitely more useful for me for networking than any national organization, because as with your preceptors, the people who I've met in the local and the state association are people who are actually in a position to hire me for a job in this area. And I have found PRN work that way. I found leads on jobs post-residency. Through those organizations, I found opportunities to present, and I've presented and developed CE for those organizations and gotten experience. I've just found that to be very valuable. Neither of those are as expensive as national organizations either, so that's a plus. The other thing that I wanted to add is that we all have at our disposal a very powerful online community for networking, and that's the SDN Pharmacy Forum. And I have met a lot of people through that forum who have really enhanced both my personal life and my professional life and exposed me to areas of pharmacy and how pharmacy is practiced in other parts of the country that I wouldn't normally have experienced. So that was a little commercial for our site, but it is a very valuable resource that is available for free.
Thanks, Sarah. Anybody else have thoughts on networking? All right, wanted to make sure everybody got a chance to talk who wanted to. Our next question says, are you able to pay off school debt in a timely fashion while still living comfortably post-graduation?
I guess I'll start with that as well. Paying off the debt it's daunting. I borrowed, when all was said and done, at the end of pharmacy school, I owed $180,000 to Uncle Sam. And paying that off it's the foremost of my mind. I have a family. I'm our primary breadwinner, and so I'm responsible not only for myself, but for my spouse, for our 2 children, and that debt looms large really over our future. What I did initially was because I was doing a residency, and we know that residents make a pittance for salary, was enroll in income-based repayment, which I believe is called something else now. I believe there's a new acronym and a slightly different program. But that kept my payment low when we couldn't afford to make the loan payments because I wasn't earning enough money. But once I got out of residency and started working,
Sarah, it sounds like
income-based repayment.
Okay, you're back. It sounded like we lost you for a minute.
Okay.
Go ahead.
Okay. The income-based repayment payments were not even covering the interest on my loan balance. And so I have switched to a different repayment plan that's still manageable for our family and our lifestyle, but that gets things paid off a little bit quicker. I didn't choose the standard repayment. The 10-year was not feasible with my level of debt. But we do send extra money every month, money that I earn from side jobs, from extra work. It all goes to loan payments, and we're making progress on that balance. So I think it is really important. A few things that I did were avoid upgrading our lifestyle right away. We held off on the big house. We drive old, paid-off cars. We have money for fun. We're not living like college students, but we are controlling our spending and prioritizing paying off that debt because it accrues interest at the rate of approximately $20 a day, to illustrate the effect of that compounding interest. So it's not something that you should obsess about. You will be able to make your loan payments as long as you work, but it's not something to neglect either, in my opinion, because that debt does balloon if you don't pay attention to paying off some of the balance, the principal balance.
Thanks, Sarah. Our next question says,
and I'd like...
Oh, go ahead. Jackie, did you want to add something?
Oh, yeah, I just wanted to add, don't fall into the same trap that I know a lot of pharmacists do. You go from making technician money to overnight making pharmacist money, which is a huge jump. Don't think that it's infinite. That is something that I unfortunately did. So like Sarah said, please try to maintain, don't make a big lifestyle jump overnight. I bought the big house. I bought a brand new car right away. And pretty soon it was very, very difficult to keep up with those payments plus my student loans. So just be careful with what you do with it. With great power comes great responsibility.
Thanks, Jackie.
That's
great
it.
Point. Bring up our next question. Can you describe a typical day for a consultant pharmacist?
This is Renee. I'll try to field that one since I've worked in long-term care for a while and as a consultant. You typically would start your day potentially with a possibly lengthy drive to a nursing home. And when you get there, you meet with the director of nursing and kind of get a feel for how things are going in the building in general. And then you find a place to work and boot up a laptop that has your consulting software and get as close to a chart rack as you can. And at that point, you spend the bulk of your day reviewing each of the charts, usually on a nursing station, which would be anywhere from 44 to 50 charts or so on a station. During that time, you may have several interruptions throughout the day, but you're focusing primarily on those charts and key medication challenges that you might see going on with your residents in that facility. Looking at monitoring, looking at appropriate therapy, looking at appropriate dosing, renal dosing, any side effects that may be going on with the resident and so forth. And you make recommendations either to nursing or to prescribers. If you find, in some cases, you may find things that may warrant getting up and going and getting someone to address an issue right away. If you find an abnormal INR or a drug interaction that may potentially cause a challenge. throughout the day, you will encounter a lot of questions from nursing staff. You will encounter a lot of the sights and sounds of the nursing home that you're sitting in the middle of. Some are pleasant and some are not. But you have to enjoy being in that environment to be a consultant pharmacist. And your day could be anywhere from an 8-hour day to a 10, 12, 14-hour day. You may get home and have to still roll up a report that needs to be provided back to that facility. And then you rinse and repeat. The days vary based on what's going on in the nursing facility and what the needs are. And you have to be very knowledgeable of regulations and clinical. So, but that's probably a fairly typical day.
Thanks, Renee. I think this probably will be our last question. What are some good undergraduate classes or undergraduate paths to take to increase your chances for getting into a good pharmacy program?
I can take this one.
It really depends on the school that you're going to.
Go ahead, but you guys can both.
Okay. So I think it really depends on the school that you're going to. I know in the Northeast there are a lot of straight 6-year programs. Immediately after high school, a pharmacy student goes into a 6-year program, and the classes are pretty much determined from year 1 all the way up to year 6. If you do undergraduate, you need a lot of science-based classes like biology, chemistry, organic chemistry, physics, all the maths, and things like that. But before applying to pharmacy school, it's very important to check the website of the pharmacy school or to get in contact with somebody in admissions in the pharmacy school to see exactly what their requirements are. Because just because you completed 4 years of undergrad doesn't mean you meet the prerequisites for the pharmacy school. So it's very important to get in contact with the pharmacy school to see exactly what's required, how many semesters of what classes, and they're the ones that'll tell you the best information for that.
And I'll just echo what Ron said. My particular school, I did an undergrad and I actually majored in chemistry, but even though I completed all the chemistry courses at University of Louisville, it wasn't the courses that I necessarily needed in order to get into pharmacy school. So I had to pay attention to what they wanted specifically, and I fit that in during my undergrad. I did that during my summers in order to get everything completed before actually applying for pharmacy school.
All right, thanks, guys. Thanks again to all of our panelists for joining us this evening and for offering your insights. There are a few questions we haven't gotten to yet. If one of those was yours, we will post those in the pharmacy forums on SDN, so I encourage you to go over there, and some of our panelists as well as just other people on the forums will jump in and answer those for you. We will also have this if you would like to hear anything again or want to share anything with anyone else that you heard tonight. We will be uploading this to YouTube, to the Student Doctor YouTube channel, so you can look for that in a couple days. And if you want updates on when that is available, you can follow us on Facebook or Twitter. And I think that brings us to the close of our evening. So again, thanks to our panelists. Thanks to our audience for spending some time with us this evening. And hope you all have a great evening.